Hello, hello. Okay, so we've just got about 8 people on at the minute, so we're going to give it 5 minutes. But welcome everybody to the Blue M webinar with Swallow Dental. Hope everyone's having a good evening so far. I'm going to do a quick short introduction of myself and my 2 reps that I have with me on screen today. And then I will obviously start the webinar. I'll give it a couple of minutes just to allow people to come on as and when. And then one thing that I will say as well, there is a chat box on here. Please do feel free to ask as many questions as possible today. Both my reps will keep an eye on the chat box and stop me for anything. So do keep this as interactive as possible. So my name is Stacey. I'm head of sales here at Swallow Dental Supplies. And today we're going to be doing a webinar on the Blue M oral care products. It is definitely one thing that I would say I absolutely love, and I'm definitely passionate about it, hence why I wanted to put this webinar on and just help out my reps while they're out on the road. So what I'll do quickly as well is I'll just quickly let the 2 girls introduce themselves, and then hopefully we'll start the webinar soon. So first of all, I've got Kay on the screen here as well that you can all see. Kay, do you want to introduce yourself?
Hi everyone, my name's Kay. I am the Midland sales rep for Swallow Dental, so I cover the whole of Midlands. So anyone that's from the Midlands here, hi. If you need anything at all, I'll reach out to you personally afterwards. We'll have a catch up, we'll have a chat, and we can take it from there.
Thank you. And then secondly, we've got our lovely Danielle. Do you want to introduce yourself?
Hi everyone, my name's Danielle and I cover the southeast of England. So again, just like Kay said, if you are from my territory and you want any sort of support or any questions regarding Blue M, please get in touch.
Thank you, ladies. We do have 2 other reps at Swallow Dental as well. I've got Shannon that covers the southwest. She is currently on maternity leave at the minute, so if anybody is on and they want any information afterwards, please do contact myself. And then I do have another rep that is Emma Roby. She covers the north of UK and Scotland. And unfortunately, she's not here this evening because she's left us with this miserable wet weather and sunning it up in Ibiza. So she can't unfortunately be on here today. But what I'll do is towards the end of the webinar, I do have a slide with all the contact information for the reps as well. So any questions, even if you do miss it on this webinar, please do ask afterwards. So let's get started. I think we've got enough people to get it started. So I'm going to start sharing my screen in a minute, if I get it right, because, you know, technology never always perfect. Bear with me. Right. I want this one. Okay. So let's just share this screen. When it's ready. There we go. Okay. So again, I can't see anybody on the screen or the chat box. Please do ask. Don't wait until the end. If there's a question you want to ask as and when, put it in the chat box and either Kay or Danielle will just tell me to stop talking for a second and they'll help me out with the questions. Okay, so today we've got a webinar on Blue M. So this is professional oral care for the day-to-day life, but also for treatments as in implant treatments or oral wound surgery or clear aligners. And we'll go through that per product. So a little bit about Blue M. Blue M's motto is it's built with passion. It is based on the power of oxygen. It's trusted by professionals and it's backed by science. And this is actually being created by dentists themselves as well. So it is in the belief of the reason why they've started this up is because it was oral surgeons themselves that started it up. So a little introduction of the why. So why Blue M? So like I just mentioned then, it's developed by oral surgeons and dentists. The product range is powered by oxygen release from natural ingredients like honey. We will go a little further into the ingredients. And their motto is the healthy mouth is a healthy body. So the main difference that we have with Blue M products compared to a lot of the other products on the market is oxygen. And what we know is that oxygen fights infection and supports healing in the body. And the Blue M formula slowly releases active oxygen for recovery and for protection. So the main key points is that it can reduce bleeding, receding, and inflamed gums. It can treat bad breath, halitosis, and also peri-implantitis. It supports healing of dental implants or mouth ulcers. We'll go through some of the different product ranges that helps with that. And it eliminates active biofilm, so ideal for patients wearing aligners. Again, I've got another great slide all about the aligners. So Blue M is trusted by professionals we actually sell Blue M well, as a distributor into the UK, but it is actually found in more than 50 countries and keep growing. I do know they've just had a huge success at the Europerio as well. And their main motto is it improves and maintains oral health. So let's dig a little deeper. Okay, just move you over there. So biofilm control. Obviously, we all know what biofilm is. So oxygen is key in fighting the bad bacteria in the mouth. And Blue M oxygen therapy helps to stop infections like gum disease and implant infections, so peri-implantitis. And how we do this is wound healing needs oxygen every step, even if anyone cuts their arm or anything occurs to the body, oxygen rushes to that site. So how they've developed this is a product, or should we say a therapy called TOOTH, topical oral oxygen therapy. So when the Blue M product touches moist areas like saliva or wounds with blood or anything, it slowly starts to release oxygen. So with this, low doses of oxygens are released, and this helps kill bacteria, grow new blood vessels, boosts collagen, speeds up the healing, and then helps the natural body's repair process. Let's go on to the next slide. So the ingredients in the Blue M products is we have lactoferrin. This is a natural protein that helps reduce swelling, boosts the immune system, and fights bacteria and viruses. We have the xylitol. So this is the sweetener from fruits and trees that helps stop plaque buildup and kills bad bacteria, but also keeps your mouth from feeling dry. We have the honey element in there. So when honey mixes with saliva, and this is only small amounts, but when it does mix with saliva, it releases oxygen. So this is one of the key components that helps that oxygen release. And that helps heal wounds and fight off bacteria. And then we've got sodium perborate and sodium percarbonate. I can never say them two right. And these are the ingredients that help release active oxygen. So these are the two main ones, as well as honey, that actually active oxygen will help towards it. So when we've got the different products, and I'm going to start going through some slides of which different products we have in the range of Blue M. This is just a quick slide to show you the amounts of oxygen that's released within each of them products. So we've got toothpastes available. We've got both fluoride and a fluoride-free one. And with the toothpaste, it's 20 milligrams of oxygen released with that product. The mouthwash, same, 20 milligrams. But then we've got the oxygen fluid, and that releases the double the amounts of oxygen. So when we are doing implant surgery, whether it's like a single case or whether it's a full arch, or even if it's a wisdom tooth removal, any sort of oral surgery, and you just need that extra bit of protection, like most clinicians might give chlorhexidine, we would recommend the oxygen fluid, because it's got that double amount of oxygen release in there as well. So you're going to give the patient an extra sort of hit with the oxygen fluid. But we would only say about 2 weeks. We wouldn't be using that every single day. So they'd use that for about 2 weeks and then go back to the normal mouthwash. Then if you see on the slide, we move down to the oral gel. This has 100 milligrams of oxygen release in there. And this is the most powerful of the oxygen topicals that we have. And this is really, really good. We have a lot of surgeons using the oral gel for placing on the sutures when they've done an implant surgery or any oral surgery. If you're having to put sutures in, you can put a small layer of the oral gel on, and that will speed up the healing process. You can, if you're an implant surgeon, you can put this around the healing abutments just to give that extra care of the conditions of the gums before you fit that permanent crown. We've got a lot of surgeons doing that side as well. But also the oral gel, you can have it chair side with an applicator tip, and you can place it down into the peri-ligaments as well. So if you're doing any pockets through perio surgery or any perio maintenance appointments, whether you're a hygienist and there's some slight pockets, you can put the oral gel down there as well. One thing I will say about the oral gel is one of our clinicians did a presentation on it at the ADI a couple of years ago, and I don't know if anyone does know this, but he did a slide where his cat had a cut on the back of his tail, and he actually used the oral gel on the tail, because it is a wound healing gel. It's not just for the mouth, it is a wound healing gel, and like within 24 hours his cat's tail really started to heal up. And if Emma Roby was here on tonight, the girls will know this story, she would also tell you that her dog, she's got a big Japanese Akita, and the tail curls, and everyone knows the Japanese Akita, and she gets a lot of sores at the bottom of her tail, and she's been to the vets for years. She's always getting like a steroid cream, and I said to her, what about using the oral gel? So she did, and she hands down will tell you it is better than any steroid cream that she's ever used from the vets. So we definitely all love the oral gel. I've used it as well for cuts on my arms. So again, really good at healing everything. So that's the oral gel. Then we move on, we've got the oral foam, which I'll go into a little bit deeper in a minute on the next slides. That goes back to the 20 milligrams, and the mouth spray, which is a minty mouth spray, that has 20 milligrams of oxygen as well. So that's just a slide showing you the different releases of oxygen in each product. One thing I will say, Blue M is backed by science, as we said at the beginning. And one of our main study has done some research on Blue M versus chlorhexidine. Now, chlorhexidine is probably the one common thing that we would find in most practices. And it's just that staple, oh, use Corsadil or use chlorhexidine. We all know that one. So the studies that was shown with this is what they did is they tested Streptococcus mutans as one of the main bacteria in the mouth. And they did 3 different studies. They did a 6-hour one, a 1-day one, and a 3-day-old one. So we'll look at this little slide here. Girls, can you see my mouse moving around on there? Yeah, perfect. Okay. So with the study, and if anybody wants this study afterwards, there is a link there. I can send it on to people. With 6-hour-old bacteria, it was shown that chlorhexidine only killed just over 10% of that bacteria, whereas Blue M killed 97% of the bacteria within 6 hours. On the 1-day-old bacteria testing, it showed that chlorhexidine killed 38% of the bacteria, whereas the Blue M was 99.94%. So it's really good at killing a majority of that bacteria. But then it shows here that the 3-day-old testing, it showed that the chlorhexidine started to dip down because the bacteria was regrowing. So we've got 20% of the bacteria being killed off by chlorhexidine, whereas Blue M, because of the oxygen therapy, it was still going up. So it's 99.96% of that bacteria killed. On this little slide here, this is the percentage of the cell survival. So with chlorhexidine, you can still see there's a lot of bacteria still surviving. But with the Blue M, you can see that it actually starts to reduce. So when you have a patient using this every day and you really want to give them every opportunity of killing active biofilm within that mouth, it really is a product that you can use every day, and you know that that patient is being compliant at home and using it, but you've got the science of the oxygen working as well. as we know, the chlorhexidine, you're not going to advise someone to be using a chlorhexidine product every single day. So I think that does stand out massively for us. And it is a lot of the reasons of why our clinicians give us great feedback, because this is just a solution for every day, as well as your specific treatments that you need to do, whether it's implants or perio. So please do reach out if anybody wants a copy of this. I'm more than happy to send that out. Okay, next slide. Okay, so just to briefly go through our product range then. So first of all, we've got the mouthwash. Now we've got some little images on there as well, the different sizes that we have. We do have a 5-litre chair side tub. I wouldn't say this one's massively popular, but I do have a couple of hygiene therapists that have this in the side of their surgery, and they actually use this throughout surgery during the day because they just love this product. But rather than using the normal mouthwash at the side, it's got a little tap on the side. I don't know if you... Sorry about that. There's a little tap here. So the nurse just puts a tiny little bit into their cup and they can use it at the chair side. We've got a 500 ml bottle that usually your patients would have in the bathroom at home. We also have the travel size on the go one as well. Danielle, our lovely South rep, she went on holiday to Mexico last week, and you took all the little travel size of everything with you, didn't you? So perfect size to travel with as well. Just some little recaps of the mouthwash. So special formula with active oxygen to care for teeth, gums and mouth. Helps prevent and treat gum disease, severe gum infection and infections around dental implants. Speeds up healing and helps grow new blood vessels. Helps get rid of bad breath. Reduces germs like bacteria, fungi, viruses on teeth and gums. But most importantly, it contains no alcohol and no fluoride. So a really good product on that one. Then we move on to the toothpaste. So as mentioned earlier, we do have 2 types of toothpaste. We've got the fluoride and we've also got the fluoride free. We've got them in 75 mils for at home, and we've also got a 15 mil small one, which is our travel side one. So again, special formula of active oxygen. I'm not going to keep repeating myself. You'll see that on each slide. Sorry. Less harsh than many other toothpastes. It helps prevent and treat gum disease and infections around implants because, again, it's got that active oxygen constantly working. Helps fight bad breath. But one thing I would say is fluoride free is safer on titanium implants. I'm not sure if many people do know this, but one of the biggest things that we should be recommending is using a non-fluoride toothpaste when someone has dental implants in, because fluoride has been proven to erode titanium over a length of time. So if somebody is concerned and they're worried, we have a fluoride free one. It's got no triclosan. I can never say that word. So yeah, the girls are nodding at me because they know what I'm like. A chemical sometimes found in other toothpastes, and it's got a very low abrasiveness. So again, we're not putting any sort of like abrasive materials in there. We're not going to be damaging any enamel. It's under 30, while others are around 80. So they have really tried to keep this as natural and as safe to use as possible long term. Next one we've got is the Oral Foam Aligner Cleaner. Now you may have all seen this one being spoken quite a bit on our social medias. We have just teamed up with Clear Correct UK as well in a collaboration, because if anything, out of all these products, there's 2 things that I am absolutely passionate about. One is the oral gel, which I will come on to the next slide with. And the second one is this Oral Foam Aligner Cleaner. Now, the first thing that I say when I do discuss the oral foam is this is not an aligner cleaner for at the end of the day. We're not advising as patients to be saying, oh, you soak it in overnight or you take it out and clean it, we use a brush. It is nothing like that. What this is what we call an on-the-go cleaning solution. So normally when I'm doing a little bit of a demonstration to a whole practice or even to patients, the first thing I always say is, what do patients complain of when they first take their aligners out? Because they're going to go and eat something or they're going to go and have a drink. The first thing patients don't like when they take it out is the smell. And then the second thing is they just feel really furry teeth. They feel like they can feel that coaty stuff and they don't like it. We all know that's biofilm building up. And one of the things that's obviously not ideal for aligner patients is that while they're wearing their aligners, we know that their biofilm is getting entrapped in there for up to 22 hours a day. When someone's not wearing aligners, we've got our saliva and we're eating and drinking during the day. So aligner patients are far more at risk of interproximal caries, obviously bad breath, and their confidence knocks as well, especially if they're taking it out. So the beauty of the oral foam is that it's like, you can see from these pictures here, it's like a little foam that pumps out. And what they can do is when they take their aligner out, because they're going to have some food or they're going to have a drink, before they put that back in, they just need to put 2 tiny little pumps straight into the aligner. And then you don't need to rinse it or soak it. You just put it straight into the mouth. The foam disintegrates. It leaves a really nice, powerful, minty breath. But the active and the most powerful thing about this oxygen, the whole oxygen range, but even more so the foam, is that it kills that active biofilm within 60 seconds. And you've seen from that little study, it's like 96% straight away killed within 60 seconds. But the beauty of the oral foam is that while that patient is wearing it inside their aligner, it continues to release oxygen for up to 2 hours. And this is why we say it's a cleaning solution on the go. So while they're wearing their aligners, you've got a minty breath still. It is constantly releasing oxygen for up to 2 hours. And then they're probably going to use it again after their lunch or then after another drink. And one of the biggest feedbacks we've had from patients is that when they take it out, they still feel really fresh. They still feel really minty, and they're not sort of like self-conscious of a bad breath or anything like that. We did the ADI show a good few weeks ago, and the one thing that we were doing, if anybody did come up and approach us, is we were squirting this onto the back of the hands and getting people to try it straight away. And instantly it was so fresh and minty. Someone actually came up to me on the stall a couple of hours later going, my breath is still minty. So it is a very, very good treatment for this, for aligners. One thing I would also say as well, it's not just for aligners. This is really good for your dentures as well. So if you've got maybe elderly patients or patients that need sort of extra care and support because they can't clean their dentures properly, so what we call is home care, we would definitely recommend them to use the oral foam, because not only do we want to get them to mechanically clean it, we can't rely on that. At least if they are using this, we know that we've got the backup of this killing at least 96% of that biofilm straight away. So I would 100% recommend this to anyone that wears dentures. I've been working with one of the implant surgeons lately, and it doesn't happen a lot, but sometimes, say if someone's lost a couple of front teeth, they might have a temporary denture first before implant surgery. Again, this is another situation. I would highly recommend the oral foam, because you want them gums conditions to be perfect before you go ahead with any implant surgery. So I really do like this product. As we can see as well, it says it's moisturising the gums and the conditions of them. So that's the oral foam. We have the oxygen fluid. So I've mentioned before, this is a higher strength of oxygen release. It's neutral taste and colour. And a really good product department we have for this one is we do have a lot of chemotherapy patients or radiotherapy patients using this product. We have a specialised pack that is for chemotherapy patients. You'll see that towards the end. We've had some really great feedback from this because we know that they really struggle with mouth ulcers or dry mouth, and this is a really good product for them. Helps in the treatment of periodontitis or peri-implantitis. So again, if you are a hygiene therapist or if you're a perio specialist, you can recommend this after post-op surgery or treatment. Helps control post-operative sensitivity and pain. So because it's got the higher amount of oxygen therapy in there, because it is a wound healer and it activates the cells quicker, it actually does help for the sensitivity and pain as well after main surgery. And again, this is fluoride free and alcohol free. Okay, bear with me. So then we have the next product, which again, I equally love on this one. And this is the oral gel. You can see from the pictures here, we have the chairside one. This is a little box that gets delivered and it's got 3 syringes and it does come with some disposable tips. Girls, just a quick question. We know the tips are single use, but we know that the tube, they can use multiple patients, can't they? Yeah, I thought so. I just wanted to double check that. Because I think that is one question that does come up a lot. Do we have to use 1 tube per patient? And it's not. You can keep the tubes. It's just the tips, obviously, disposable. Then we have the 15 ml little tube. You can see it's only a hand size, travel size one. And this is what we call the at-home one. So what we do is we have some clinicians, they would use this chair side, treat the area that they're wanting to treat and explain to the patient what they're putting on. And then they would give this to the patient and get the patient to continue placing the gel at home. So you can put this on teepees and clean in between, and if you've got a pocket area, or if it's on sutures, you can just put a thin layer on that suture every day or so. But this is the oral gel. And remember, this oral gel has the highest level of active oxygen. So it's 100 milligrams of oxygen released. So it is a really, really strong oxygen product. One little top tip as well for anyone out there that does suffer with spots like me, because I definitely do sometimes. The girls are probably laughing because they know what I'm going to say. This really helps with spots as well. So I guiltily definitely have some at home because it helps with everything. Another key fact as well, we have a lot of practices keeping a tube of this in their first aid kit in case there's any sort of minor accidents at work. Because this is a wound healing gel, it really can help with any cuts or grazes within first aid. So that's another top tip. So this helps by healing slowly and steadily releasing the oxygen. As mentioned, it boosts and growth the new blood vessels and collagen, which we know is important for healing. It helps kill bacteria. So like we've done there on the study versus chlorhexidine. I just had feedback from one of my clinicians, and he was using the chlorhexidine gel, and he switched over to the Blue M gel, and he genuinely has seen a dramatic difference. He's going to be kind enough to leave us a testimonial because he was just blown away with how good this product is. And that's always great for us because we love hearing feedback. Again, used for treating any bacteria, viral or injury-related mouth problems. We have one clinician that does adult tongue ties or frenectomies and stuff, and they use it on that as well. He absolutely adores this. It helps reduce pain and sensitivity after dental surgery and supports prevention and treatment of gum disease and infections around implants. So, you know, if you're going to use it for anything, even if it's just a condition and keep them gums nice and clean post-implant surgery, I would definitely recommend this product. can tell I'm very passionate about this product. I hope anyway. So as mentioned earlier, we do have quite a few different packs that we can do. So we have a periodontal care pack, we have a chemotherapy care pack, we have the orthodontic pack. So if you have got them clear aligners within practice, we would recommend this one. And then we have the post-implant care pack. These ones come with a little wash bag. They do sell, and we do have people asking for these ones, but what I would say is our main popular ones are these two. So we've got the post-surgery implant care pack, and it comes with a little tiny ice pack on there as well, and a soft toothbrush. It comes with the oxygen fluid, the fluoride-free toothpaste, and a pack of the oral gel. And we have another pack, which is the everyday, day-to-day care pack, which is the normal mouthwash. It's got the gel in there and the toothpaste with a soft toothbrush. Now, we do have a newer orthodontic care pack. I just don't have an image of it at the minute, so I do apologise. It has just been released. But the orthodontic everyday pack contains a full-size oral foam gel and a travel size one as well. So ideal for anyone that's got aligners within the practice, keep the large one at home and the little travel one size in their bag or at work. So that's the two packs that we've got.
Sorry to interrupt you, Stacey.
Yeah.
I think someone's asked a question.
Mm-hmm.
They said, can you please repeat what you said about patients with implants and the use of fluoride toothpaste?
Yes, so there's quite a few studies out there, and do you know what? I will be completely honest, I didn't even really know about this, and I worked at Strongman for 8 years and sold implants for years and years, and I've nursed with implants for the last 14 years before that. So one thing that I have covered while looking into the Blue M and stuff like that is there's been quite a few studies out there, and I can only go off what's been put on a study, but apparently fluoride can sort of deter the titanium material. So if anyone is placing titanium implants, which is basically all implants, it's best to advise a fluoride-free toothpaste, so then it keeps the longevity of that implant for as long as possible. I think it would take a long time for fluoride to really erode the implants, but it's just to prevent any risk of any sort of material exposure. If fluoride is going to be in contact with that, we just want to try and advise the best advice we can do. So I hope that answers the question on that one. Again, if anybody wants to contact myself or the reps afterwards about that, I'm more than happy to find the studies and send them on. But it's something that I actually discovered quite recently, which I didn't even know about. So just a quick recap, and then I'm going to go over how can that look in your practice with regards to Blue M. So a recap of what the products are. It's an instant slow release of oxygen. It does not develop any microbial resistance. It's free of toxic components such as triclosan, fluoride, and chlorhexidine. It's great penetrations into tissues, reaching deeper tissues because you've got the oxygen going in there. And no side effects. No side effects of what we've seen so far, and easy application and use. And that's what we want. We want the compliance of patients to be able to use this as an everyday solution. So do we have another question?
Yeah, we do. Yeah. Someone's just asked, are we able to get posters, etc., to help patient awareness of Blue M?
Do you know what? That's the perfect question, because my next slide that I was going to go into is how can Blue M work within a practice and what support do we offer? So I'll just go on to, so I'll leave this up on here now as well. So what that leads on to is how can Blue M work within a practice for you guys? This is the information of all our reps. Our reps can come into the practice and do full training and product training with all the team, including receptionists and dental nurses or anyone that's involved. What we have is we have posters available. We've got video links for TVs within the practice. We have patient literature, so you can give to patients, so all the patients can know about the history of what oxygen can do and why it's good for the patients. We also have what we call prescription cards. These are really, really popular, and I would, if anything, definitely recommend these. And what you can do as a practice or as a clinician, you can recommend which products to use, tick which products you've recommended on the prescription card, and then give this to the patient. The patient can then, this is where you've got two choices as a practice, go to the receptionist with the prescription card and say that my clinician has recommended these products, and they can buy them from behind the counter if you want to stock them in practice. Or if you don't want to stock them in practice, they can buy them directly on our patient-facing Blue M website. One thing I will make clear, because a lot of people ask this, if you go onto our Swallow Dental website and look at the Blue M products, the RRP price you will see on that website is the patient price. If you have an account with us and you want to order some Blue M products, you will automatically get a 15% discount applied at checkout, or the girls, they can sort it when they place an order for you. And the reason why we haven't put the discounted price on the website is because we've had plenty of incidents where the public have wanted to buy the Blue M products. They've seen on our main website that you guys can get it cheaper, so they will try and ring and say that I want it at the dentist's price. But obviously, we can't do that. So as a practice, you can stock them and you will get them 15% cheaper. And then when you sell them in practice, you can sell them at the patient RRP price, so you can gain 15% profit within the practice. I know quite a few practices that do that and they like that, because not only are you recommending a great product, you're also gaining some revenue back to the practice. Or if you've not got space to stock them, you can give the prescription cards, and like I said, the patients can go onto the patient-facing website and they can order it from there. It is next day delivery, so we try and get them sent out as soon as possible. Like I said, that's the information on there. Emma, poor Emma, everyone will say, why does her territory look so big? But if anyone's from up north, you do know that we're so sparse. And poor Danielle, I would say, has the busiest territory in London. So if you're from the north or Scotland, please do reach out to Emma. We've got the lovely Kay on screen here. She's in yellow. And as mentioned before, anyone, if your postcode is in the purple area, Shannon is currently on maternity leave, so it will be myself, and my email is on there. And then we've got Danielle, who is very, very busy in London. Blue M, I would say, is probably your busiest area, isn't it, Danielle? She's nodding. Okay, so that, and again, I've left a little bit at the end just in case we have any questions. So I will stop sharing for a second. And then if anybody does have any questions, I really, really would prefer anybody to ask. Because it might not be a silly question. Anyone can learn from someone else's question, so that'd be great. I'm just double checking. Can you please repeat what you said? Oh yeah, I've answered that one, didn't I? And then just check this one. And we have to get posters, yeah. And like I said, the posters, patient literature, they're all free of charge when you actively buy the Blue M products. So if anybody is very interested, I am more than happy for anyone that has attended today on the webinar. I'm more than happy to arrange, just as someone's put on there, I'm happy to arrange some samples. So what my reps will do is, if it's okay with you all, we're going to send you a little email just as some feedback from today's webinar. And if you would like some samples of the products, we can arrange for this to be sent out to your practice. And more than happy to answer any questions and any follow-ups. What I would say, and I genuinely say this to everyone, is take advantage of having a sample and just try it. Either try it on yourself or give it to a patient that you can get honest feedback from them, because the proof is in the pudding. I really think you've just got to try it to see the benefits of it. But no, that's the introduction to Blue M products. So if anyone, send a quick. What did you say? Let me look. How many? What was the question? 1 second. We go on the right page. How may we get samples? Yes, so your reps will be reaching out to you and we will arrange what samples you can have. You will also get an email from our marketing department with the questionnaires because for me to give you an hour's CPD, obviously I'll need to give you a questionnaire with feedback on there, and then you will get the CPD from our marketing head office team. I will try and get the CPD done as soon as possible. I know we've done some previous webinars and it's other departments that's doing the CPD. I will make sure that the CPD gets sent out immediately. Has anyone had allergies? I've not seen anyone had any allergies as yet. There's no evidence, there's no reports being done. So hopefully that's all right. I think I've got another question that's come up there with me. I like this, by the way. I like it when everyone gives questions. There is evidence supporting the use of fluoride toothpaste patients with implants where the thread are exposed, but it may help, but it may not be beneficial in the long term. Okay, so there is some evidence. Like I said, what I've done is just read some evidence that it is best to try and advise fluoride free, but I can help with any researchers if anybody wants one. What I would happily do as well, like I said, is I'm more than happy to send the scientific research papers of the Blue M oxygen versus chlorhexidine. If anyone is geeky like myself, it is a good read. And do you know what? My daughter's had aligners, and the first thing I've done is give her the oral foam for the aligners, even for retainers at night time. Oh, got another question. Let's have a look. Is there any literature to support how effective the gel is in a perio pocket versus dilution from gingival? Oh, that is a good question. I haven't got any scientific papers, but I've got a lot of clinicians that is using this within perio. And if anybody wants me to put them in touch with our perio clinical specialists, our key opinion leaders, more than happy to do that as well. I am actually looking to put in some more webinars on. If there's anything that I'm wanting to do at the minute, it's the Swallow Academy, really trying to encourage more opportunities for people to learn. So I am actually working with some of our KOLs to come on and do some clinical cases and case reviews as well. And if anybody has been using Blue M for a while and they're keen to do that and help me, definitely get in touch with me. I'm more than happy with that as well. Got some more questions. 1 second. Dun, dun, dun. Let's have a look. That'd be great. I would like the chlorhexidine versus Blue M. I could definitely send that out, and any testimonials, of course. Like I said, you don't need to request the information. The girls will get in touch with you, and you can have the contact there. Any information or any samples that you would like, please order through the girls over the next day or two. I will pass on your details to the girls. So, girls, I'm gonna be straight on it. Mm-hmm. Any other questions before I end it? So you can all have a lovely evening to yourself. No, can't wait to try. That's what I like to hear, because honestly, I promise, I know I get passionate about a lot of things, but Blue M just blows my mind. It's absolutely fantastic. And girls, what do you think? Kay, you've seen quite a few cases now, haven't you?
Once you try it and use it, like I was an Oral-B girl through and through, and then I used Blue M and I was like, I love Oral-B. And then I tried Blue M and I just haven't gone back. Like I just, for my daily routine, Blue M all the way. And then like mentioned with the Oragel as well, it's amazing. Like any cuts that even you get, kids, anything, just literally a little bit on the pore, anything works amazing.
Yeah, no, it is good. But Danielle, do you want to say anything? I know you've got it on mute because she's got a little one in the background, because we're all balancing parents, really, aren't we? But what I will say is thank you to everyone for spending a good 45 minutes on your Tuesday evening. If anyone else has thought it's a Monday like me, it's going to be a long week. Thank you so much. We will be in touch with your CPD and any studies that you want and any samples. Please take advantage of the samples. Like I've said, everybody that's attended, I'm more than happy to give you some samples. So thank you so much. Keep an eye out on our Swallow Dental page or our social media pages for any more webinars that are coming up. or if you've got any suggestions of what you would like to see on a webinar, I would definitely be happy to have any information on that, because anything that I can give to you guys, the better. So thank you so much, everyone. I like that. Bye all. Thank you. Right, see you later, girls.